This is where the atria are kind of doing their own thing, but they're doing it in a pretty regular pattern, if you will. And your ventricle is just kind of going along. So this is a regular rhythm. Atrial fibrillation instead, though, is where the atrium are going to be quivering like this. So it's not this nice, beautiful squeeze. And then the ventricle's kind of just trying to figure out what it's supposed to do and doing its own thing. So in atrial fibrillation, they call it an irregularly irregular rhythm. So that's where you feel a patient's pulse, and there is no rhyme nor reason to it. You can have a couple beats right in a row, and then you can have a long pause, and then you can have another beat, and then it's completely irregularly irregular. It can be slow, it can be normal, it can be fast. So that's one that you can kind of see. Deadly dysrhythmias, these are ones that are important to know because generally you're going to be needing to do BLS to help out with that. Ventricular tachycardia, so ventricle is the bottom chamber of our heart. This is where tachycardia is just plugging away, doing its own thing. Sometimes you can have a pulse with it. A lot of times, though, that patient is going to go pulseless and you're going to start CPR on them. Fibrillation, so fibrillation again is that kind of just wiggly around. So what can you think? You got a ventricle, normally it's supposed to be doing this, and now it's just doing this. Well, that's not going to last long, right? That's why these patients do not have a pulse, and we need to start CPR and start getting them going on and helping get them out of that rhythm as soon as possible in hopes of saving their life. Asystole. So again, what was systole? The working phase, perfect. So it's that contraction phase, right? A kind of meaning not, so no contraction. So that's your flatline patients. There's nothing going on. There is no electrical conduction happening in the heart, and they're now definitely someone that you're going to need to be doing CPR on. Okay. Here's just, a list of, again, the symptoms you could be noticing: fluttering, skip beats, chest pounding, dizziness or lightheadedness, pale or sweaty, fainting, shortness of breath, chest discomfort, changes in level of consciousness, all depending on the rhythm and all depending on kind of exactly what's going on with it. Any of these symptoms, go ahead and let the nurse know, check some vital signs, see kind of what you can help to report to them. They lose consciousness with no pulse. What do you guys do?
Start CPR.
Yep, call a code, start CPR. Get going with your BLS. Okay, so we're almost at the end here, guys. How are we doing? Do we need a stretch break or doing all right? Okay, so hypertension. Hypertension is going to be a high blood pressure. It's a condition in which the long-term force of the blood against the artery walls is great, and it can lead to health problems. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. So you kind of mentioned it earlier, but what is a normal blood pressure? Perfect. 120/80, you got it. So when it's considered high, hypertension is going to be anything with your top number, your systolic greater 140 or greater, or your diastolic, your low number 90 or greater. Increases the risk of. So high blood pressure on its own likely isn't going to cause symptoms for a patient, but the problem is that if someone has chronic hypertension, long-term high blood pressure, puts them at higher risk for all of these things. Two of them, which we've already talked about, which is the heart failure and the heart attack. But stroke is a big one that can be caused from having a long-term high blood pressure. Causes: stress, obesity, diabetes, age, excess salts, unhealthy diets, alcohol, smoking. All of these can make you at more risk to have higher blood pressure. Signs and symptoms of hypertension: you could have headaches, chest pain, shortness of breath, vomiting, dizziness, blurred vision. Likely, they're not going to have any unless their blood pressure is crazy high or there's something else that's going on. But you always want to let your nurse know kind of what's going on too, because they also might have orders from the doctor that say if the blood pressure is this over this or greater than this over this, you can give this medication to help out with it. Or they might need to call the doctor and say, this seems too high, what can I do? So you always want to let your nurse know about high blood pressure readings. So again, I would say anything over 140/90, it wouldn't hurt to let your nurse know. And then they can let you know too, oh, that's kind of normal for him, or okay, but always doesn't hurt to always just talk as much as you can to them. Sorry, I keep forgetting to turn this off. Okay, if symptomatic, notify the nurse immediately. Here's another big one. If you're doing one of the automatic blood pressure cuffs in the room and you get a real high number and they haven't had a high number, maybe you could try it on the other arm just to see, or you could try a manual blood pressure cuff. And that way when you go tell the nurse, you can kind of give them a little bit more information. I knew this was not a right one, but I went ahead and checked it in this one. And hey, it's still high. So, you know, this is truly seems to be what's happening for this patient. Okay, it's a silent killer, you guys. You saw all the things that it can lead to. So it's one that, just in general, we're trying to get patients' blood pressure controlled. Okay, we're going the other end. Hypotension, so that's a low blood pressure. Can be a chronic, non-serious problem. Some people, again, some people might have a heart rate in the 50s and that's normal for them. In the same case, someone might have a blood pressure 100/60 and that's pretty normal for them and they feel great with that. However, if it is severely lower, significantly lower than usual, blood and oxygen supply to the brain and other vital organs may be insufficient. So can become very dangerous very quickly. So normal, again, 120/80. Low, 90/60. Too low, 60/40. Dangerously low, 50/33. Yeah, so hopefully you'll never have to have a patient with that low of a blood pressure, but that's going to be really scary if it does happen. You want to help immediately if you notice that. Orthostatic hypotension. You guys kind of familiar with this and the concept of doing this monitoring on patients? Have you done this yet? Okay. Has anyone else taken orthostatics before? Okay. All right, well, we'll run through it. It's also known as postural hypotension, so it's going to be your patients who sit or stand up quickly. Their body doesn't do the regulating that it needs to do fast enough, and so your brain's not getting blood fast enough with the change in position, and so it can cause dizziness or fainting. Can be caused by medications, can be caused by aging. And so sometimes you might have your nurse say, hey, can you go do some orthostatic blood pressures or orthostatic vitals on this patient? So I want to kind of talk through with you guys what to do. And this actually has changed since I was last out on the floor, so I learned something new while getting this presentation ready too. So it used to be you would do laying, sitting, standing. Now you're just actually supposed to be doing laying down and then standing. So you want your patient to be resting in a laying position for a good 5 to 10 minutes or so, and then you want to check their blood pressure and the heart rate. Help them up to a standing position, and then you want to check their blood pressure and heart rate after standing for a minute, and then you want to repeat again after 3 minutes. But if you're having any symptoms at all with them standing up and they're saying, oh, I don't feel good, I feel dizzy, I feel lightheaded, get them sitting again, get them laying if need be, and you can always just go tell your nurse, this didn't feel safe, so I didn't do it, and they can figure out where to go from there. So to be positive for this, it's a drop in systolic, so a drop in that top number greater than 20, or in the bottom number, the diastolic greater than 10, or if they have any of those symptoms, lightheadedness or dizziness. Okay. Dangerous hypotension. So there are those patients that oftentimes they might be coming into the emergency room with these types of things. Trauma with extensive blood loss. They've lost a bunch of their fluids. Serious burns, GI bleeds, if they've got an intestinal bleed, anaphylaxis, or they're having a bad allergic reaction to something, a heart attack, cancer, heat stroke, serious infection. All of these are kind of the ones that are going to, if anything, would be showing those super low blood pressures. So signs and symptoms, dizziness or lightheadedness, rapid heart rate. Again, your heart's trying to compensate for there not being enough blood pressure, and so that's saying, well, maybe if I beat faster, that it's going to help out get the oxygen to the body. Fatigue, lack of concentration, cold, clammy skin. Report the low blood pressure readings to the nurse. So I know that technically low is 90/60. I would prefer probably when I was on the floor if I would be told anything under 100 for a blood pressure. But of course, if they're having any symptoms at all, even if their blood pressure is 105/60, you still want to go let the nurse know. Instruct the patient to sit or stand up slowly. Prevent falls, ensure safety. And again, you can always double check that blood pressure in both arms. Okay. You did it, you guys. Ready for some questions? All right. So, The night shift CNA is giving a report to the next shift. So you're getting a report from the night shift CNA. They're telling you what's going on. Which of these indicate that they have performed an inappropriate task and that you should probably report that to the patient's nurse? Okay. Patient's on strict diagnose. I keep the urinal at his bedside and check hourly to see if it needs to be emptied and recorded. You guys think that's inappropriate, or is that kind of an okay thing? Good. Patient gets short of breath walking to the bathroom. I had him brush his teeth in bed so he wouldn't get too winded. It's appropriate. The patient's recovering after a heart attack. I tried to clump my cares for her to give her time to rest. Yeah, probably wouldn't be a bad thing, right? Patient has a DVT in her right calf and has been very painful. I massaged her leg last night to help relieve her discomfort. Okay, you guys got it. Exactly. If they have a known blood clot, you do not want to be massaging that area. Okay. Which of the following reported signs or symptoms from the patient would warrant urgent nursing notification? I'll let you guys just kind of read through those and then let me know what you think. You guys ready? Okay. What do you think? 3. Perfect. Yep. Chest pain. Or in this case, this one's having back, jaw, and right arm pain. But all of those should be triggering your brain that this isn't normal either. This could be a symptom of something real serious with the heart going on.
Would you say that the pain goes sometimes?
Yep. They can go up the neck and the jaw, the back, the shoulders, the arms. Yep. Okay. Upon entering the patient's room, the CNA notices the patient is pale, confused, and short of breath. Which of the following interventions should be performed first? All right, you guys ready? Okay. 1, yes. Okay. That one you probably might not have even needed the choices. You know, something real serious is going on. I need to go tell the nurse right away. All of the other ones are appropriate things to do for sure, but letting the nurse know is going to be your number 1 priority for that patient. Okay. Which of the following describes the correct pathway of blood through the heart? So I'll just talk through this. Do you guys remember which is the first chamber that the blood hits? Perfect. What's the next chamber? Okay. So you guys probably already have figured out which one it is. So we'll just go through it one more time. Right atrium, ventricle, lungs. Then now you're on your left side. Left atrium, left ventricle goes out through the aorta to the rest of your body. Okay. And that one again, after this class, don't super need to know that. Don't memorize all the different pieces of it. But I think it's kind of helpful to know the generalized anatomy and physiology of the heart because it helps you figure out why these diseases are happening or what's going on with the diseases. Okay, last question, then we'll take a little stand and break. Which of the following interventions is an example of best practice? I do kind of want to go through these all together because I think it's important to talk about what's wrong and the ones that are not best practice. So number 1 is measuring a bed weight instead of a standing weight to let the patient sleep longer. Exactly, yep. And so, you know, ideally, especially if you're working on a night shift, you would, when you're helping them up to the bathroom, try to grab a weight on them then versus having to wake them up at 5 in the morning because you haven't been, you know. But, I mean, if you have to, I'd still say that a standing weight is going to be better than a bed weight. It's going to be way more accurate. Number 2, encouraging a post-op patient to ambulate until they feel short of breath and need to sit down. No, right. Yeah, you don't want to ever push your patient that far. Number 3, verifying an abnormal blood pressure reading on both arms before reporting to the nurse. Yep. Good. Yep, that's the right answer. How about number 4, though? What's wrong with it? Removing SCUDs, so those sequential compression devices, for 2 hours every shift on a post-op patient to promote healing. Right, yeah. You would never want to take them off for 2 hours without letting the nurse know or you know, I mean, sometimes patients are go, I do not want those things. And you know, the nurse can come in and try to explain every reason why they're super important, and then they still say no. But, you know, that conversation needs to happen, so you should never just leave them without their scuds. Okay, let's take a little break. We're going to play a game in a second, but let's move around. So Kelly, we can